like to welcome everybody to our first Health and Wellness Subcommittee meeting for this academic year. We have a lot of new faces on the committee, so I thought we would start off by first going around and introducing ourselves. I'm Debbie Lacasco. I'm on the current school board, on the school committee, and I am a retired medical practitioner who was the medical director at a college in New Jersey, and I've been here for 2 years now. So if you want to go.
Hi everyone, I'm Sally Davidson. Last week I started as the Equity, Belonging, and Community Engagement Coordinator here. Nice to meet you.
Hi everyone, Rob Mezzanotte, Assistant Superintendent. Thanks so much for being here. I appreciate you joining our group.
I'm Pam Pinero. I'm a parent, a physical therapist, and a Girl Scout leader in town. And this is my 3rd year being on the committee, I believe.
Trish Colley, Child Nutrition Services. Good to see everybody. I'm Jackie DiLorenzo. I'm the Early Childhood Supervisor at Fishing Cove.
Sherry Kennedy, I'm a parent. I have twin daughters at Davisville. I've been very involved in their PTO previously. I will be too at Davisville. And I am currently not working, but I previously used to work in sales, consumer products, and my husband and I owned a senior care business.
So I'm Diana Ferraro. I'm a substance use counselor. I also have a daughter at Kingstown High School and some clients there as well. I'm Caroline Serio. My daughter just started kindergarten at Stony and I work as a PA. I teach PAs at Johnson & Wales, and I actually run the wellness program within their program. So you can.
Hi everybody, I'm Karen Wetherill and I'm with Rhode Island Healthy Schools Coalition.
And welcome to everybody, and that rolls right into, because you're the next on the agenda,
Oh.
the Rhode Island Healthy Schools Coalition Prevention.
Okay, one of the things I wanted to do at this meeting was, some of you may be aware of, but over the past few years, all of the elementary schools in the district participated in Recess Rocks and Rhode Island training. And this is a program that it's our 10th year right now, and have worked with over 150 elementary schools in the state, really supporting so that Recess is a fun and safe, inclusive and kind time of the day and space for all kids. The training, it's 2-day training. It is not with kids. Some people will say, but do you really have to teach kids how to play? And this isn't teaching the kids, but it's working with the adults in the building to set up a system and an environment that makes it so that all kids will be active and develop strong social emotional skills at Recess. So when the final, and I can't quite remember now which was the last school, did the training, we then say there's several districts in the state that all the schools are trained, so then we produce these banners. So I'm gonna leave these here with you, Rob or Trish. I don't know how it was decided, but so this is
Forest
Park. So you can see, and it just is, it can be used, they can be outside. I know some schools put them right outside, some put it inside the school somewhere, but it really just lets everyone know coming in that play is important in this school, and that, as I said, it's designed to be safe and kind, and inclusive for all kids. So, yeah. They are labeled and, however you distribute them, okay? And then the only thing, I know some of you were at our recent Breakfast for School Wellness Leaders. This is an annual event that we do every year, and I did bring, and I don't know how many I have, but I have more in the car if anyone was interested in the program book, which does have some QR codes that access some information and programs, and this is the exhibitor guide, so we always have quite a number, like 48 this year, of community organizations with resources and supports for schools that are available. And then the program this year, we focused more on locally and had a number of panels of different schools sharing successful initiatives. So everything, and how many people, I'm not even sure who was there, I don't want to, okay, so then.
Me.
Yeah, okay. Okay, good, so maybe I should look and see if I have more, if people want them, I know I have them in the car. But there are programs and, on our website are links to all of the slide decks, but we had everything from, school district, Central Falls, talking about their cell phone free, policy and how that they've implemented that, another school in North Smithfield that really looked at their data around attendance at their high school, and recognized that mental health was an issue on why some students weren't coming to school, and worked with students and developed a whole program around that, and they really increased their attendance by engaging the students. Another one on a mental health program, South Kingstown High School, so a number, one as well on their school meals program. There's another opportunity too, which I think Trish knows about, where we're collaborating with Johnson and Wales. So some of their chefs and student chefs, that will, are available to go out to schools, and the whole idea is looking at school menus and helping to train, giving some support to frontline kitchen staff on whatever skills they may need, knife skills, whatever, and developing recipes that are more diverse and meet the needs and sometimes the cultural needs of the kids who are in the school, so. So I think,
Okay.
that's that. And
Thank
I'll,
you.
Either I can get some more and
Yeah,
pass them on.
Okay, next on the agenda is South County Prevention Coalition. Anybody here from that? No? Okay. The focus of the meeting today is going to be looking at, which we had started and that kind of stopped, and so we're gonna pick it up again, is the North Kingstown School Department tobacco policy. There are, everybody should have copies of the policy. The first policy would be listed as
Do you have copies for us?
No, I assumed everybody would make their own copies of the, it's online, I mean, if you have.
Do you want me to run off some copies? I can run some.
Sure,
Just so we all have it.
okay.
How many we need?
I'll take them.
I don't need one.
I don't need one.
Okay.
But there's, two different policies for the school currently. One of them applies to anybody who comes to the school, and then the other policy applies to specifically the students. In all cases, tobacco is not considered something that we're allowing on campus, and that includes vaping or any other way to inhale anything. One of the issues is that the first policy, which addresses anybody who comes to the school, notes that it's part of the administrative policies, which actually don't exist anymore. So that policy, more than likely, we're just going to void, and I would hope that when we create our new policy, we'll just include everybody in that, whether you're a visitor, a staff member, or a student, these are the policies. The state of Rhode Island has issued a guide and a policy that they would like to see schools adopt. It's a very, very thorough policy, and the one thing that I noticed is that rather than being punishing in any manner, it's educational. Right now, our policy states that if an athlete is caught smoking, they're suspended from the team for X number of weeks of play. I don't agree with that, because punitive measures never actually bring positive results to students, and many times it just makes them do it more. The policy from the state is very educational in nature, that regardless of who you are, that we will have support services, we'll have cessation programs available, whether they be online, whether they be in person, but that we're gonna educate on why you shouldn't be doing tobacco versus saying, okay, you're suspended from the football team. There's also an inequity there, because that only happens to athletes. That doesn't happen to student who's in the science club and now is told, oh, you can't be a member, you're suspended from the next 2 meetings, or you can't participate in a science challenge that may be going on. So I think we need to look at that too, because I really don't wanna segregate out our athletes to make everything more punitive to them than it is to every other student. So, if you take a minute and look at those policies that are going around and the state policy, then we can open up some discussion on, what we wanna do. And I understand today's meeting was rescheduled and people probably, this was a last minute issue. So I really don't expect us to rewrite the policy today, but maybe everybody can take it, look at it, and make a determination, what you would like to see in that policy. And again, the state policy is simply a guide for us to follow.
So this is the state policy, right?
No,
Tobacco-free.
the one.
Yeah, it says the model policy.
The model
The model
policy from the state.
So is this the one they like send out to all the schools saying, I noticed, and then you would like insert the district?
Yeah, because they have in brackets, like put in your school name.
Yeah.
And so this one is just on
the one we have
tobacco,
now?
right?
Right,
Tobacco policy.
right.
So, but we'll also
the one
be
we have
doing
now.
something on other substances?
Yes, we will. We'll go
Separate.
through each of those policies separately. This is actually, I'll hand these out. This is actually from the policy manual from the school.
So like the school one right now has both together, right? Cause it says driving and alcohol use.
Right, right.
But then
This
there's
is
also
actually
one that says
the
just tobacco.
policy manual
this
from
one
the
is
school.
just-
So these are all topics that are
Like-
under our purview
Not the
to
students.
discuss or to change.
Does the state have a policy that has both, or like, do they have a separate alcohol policy and a
The
separate
state
drug
has,
policy?
I
So they have
believe
like
they have separate policies, yeah.
Thank you.
These policies are rather old, and I couldn't tell you when the last time they were updated. Most policies no longer include alcohol and tobacco, they segregate them out, because they're two very different types of addictions. And that's something that we can discuss later too.
So, one thing I noticed, it does refer to the student assistance counselor. Is that person here, or,
I'm not
Is
even
that a
sure, I'm
full-time-
not
have
even
one?
sure we have one,
okay.
to be honest, I've never,
I think it's someone, but I don't know.
think there's one at the high school.
there may be at the high school, but I don't think that it goes into the middle schools or the elementary schools.
I think my concern with the new policy was the same that I kind of felt before when we touched on it, is the mandation of the counseling therapy. To me, that's a slippery slope where we're getting into medical treatment. And I think, I understand not the punitive, kind of getting away, where is that helping a child that's addicted necessarily? But I think it's a slippery slope to mandate a child to counseling. I feel like that's medical treatment that the school's taking over, whereas inform the parents, whatever discipline the school wants to provide, maybe the parent has to provide a note that they sought outside treatment, or they've talked with their family doctor, you can provide resources. That's something that I liked in the old policy, was that the families were provided with some resources. This, I don't know, and then there's also a mention of, like a retreat on there. That raises a lot of flags to me. What does that mean, and what does that entail?
And which one is that in?
It was the
Rhode Island.
Rhode Island.
Is it the,
Yeah.
yeah, the Rhode Island one, right?
Well, I know like some schools will, or are considering, like rather than having that student go to detention, for the detention, to end up being some type of program like this in-depth program. And that, I mean, how medical is that? It's really more like informational. So I liked that.
My understanding of the counseling and therapy was pretty much exactly what you were saying. Rather than have them go to detention, or rather than have them miss a football practice, they're gonna meet with one of the counselors who will either do this online program with them or discuss the issues. I mean, certainly if the kid wants to come back and discuss further with them, that would certainly be up to them. Maybe we just have to change the terminology, that it's not really counseling therapy, but that it's a educational program that they have to attend.
So this looks different than what I'm looking at is what you sent out, the Rhode Island tobacco-free school model policy.
Right.
Yeah.
She's over passing around now.
Oh, okay, sorry.
Updated 2022.
Right. So it mandates,
It does.
yeah,
And that's
like
what you're
that
asking.
feels like therapy to me, not education necessarily.
Just what page are
That
you
part
on?
is.
That's exactly what you're looking at.
Oh, the like, is that
The
right?
last one,
Page 4.
Page
Right,
4.
Page
Right.
4, first violation.
But if
Yeah.
you do have a student assistance counselor, isn't that person like a licensed?
well, do we, first of all?
Probably do
When
at
you
the high
left the
school.
room, we have a student assistant counselor.
We do, at the high school.
At the high school.
Full-time?
What
Yeah.
about the middle schools?
Middle schools, we do not have a student assistance counselor.
There is that on there.
And
Yeah,
would
it's
that
definitely one of the high
student
schools.
assistance counselor have the capacity to implement a policy like this?
So I'm sorry, I'm just
Yeah,
kinda getting
right.
back from running off the copy, so what are we, which one are we looking at exactly again, I'm sorry?
So,
Page
page
4.
The Rhode Island one.
Section
first
4 sanctions.
Mandatory
Got
referrals
it.
when in
Okay,
school.
so,
So my question was, what are the credentials of the student assistance counselor?
So a student assistance counselor is somebody who's contracted through an agency called the Rhode Island Student Assistance Services. And they are basically there to provide help to students who might be seeking help with substance use, is their focus. Sorry,
So are they someone who can provide that, or are they just linking
Yeah.
them up with outside services?
no, they can provide it.
Like, are they
And it's-
a licensed therapist? Maybe
And are they a
just-
mental health therapist or an actual addiction person?
So I know their purpose, what they deal with at the schools has to do with substance use. What their exact credentials are, I don't know offhand, I can check on that, but I know that that's what the program is set up for in schools, and in really schools throughout the state. It's a program that's set up specifically for, the issue, or the topic of substance use with students, to provide help for students who are seeking help.
And it just says that person would do a, what does it say?
1 to 3
Screening,
sessions.
assessment, and motivational interviewing, and then the educational programs are not that person, like this one, student must complete, and one option is in-depth alternative. That's a evidence-based program that's
But I mean, this seems,
online.
I mean, the first session will last no fewer than 30 minutes. I mean, that's a long time for like kids in a high school, and I don't know.
I thought it was a short time.
Yeah, well, I'm thinking, think how many kids are in a high school, 30 minutes, I don't know, to me, I think you need to give parents the option to seek their own outside, not mandate from a school.
So I guess it says the school will notify the parent and guardian, but I know what you're saying, like, but you notify the parent, does the parent have the option to say, I do not want my kid,
Right,
my child to do this
Participate.
program? Yeah,
right, I think that's what we should have.
yeah, cause it doesn't, I know what you're saying, it just says
Yeah.
we notify the parent, but it doesn't really say either way, like, well, what can the parent do?
Yeah, and I think,
But
you know,
that's
does the
like
parent
this-
have the option to sit in, to see the resources prior to?
Yeah, I'm sure that the programs would be available for the parents to view, like the in-depth program. I would see, I don't see why they wouldn't be able to view those. But I'm a little concerned with your concern about having them see the school assistance counselor. Because if a student violated anything else, they might see the guidance counselor, and again, they're gonna notify you that they're being, they had a fight at school, and now we're having them talk to the guidance counselor. I'm viewing this just as a substance abuse guidance counselor in the same manner, so.
I think 'cause we've had so many outside, like, mental health, like, I think there's a weariness to parents with outside resources coming into the school, that this feels that you're taking away control of a parent of their child's health and mandating this, and especially like option 3, the retreat curated by prevention specialists.
That's just, and you pick one of the options though, right?
But I mean, could option 4 be parents, you know,
Choose an outside provider.
I think we need to give that to parents.
I just wanted to interject that, I think your point about dealing with school behavior and behavior as it impacts the school is important in terms of consistency. Are we gonna raise questions with every, a fight happens and this and that? And as much as the schools might have a need to provide extensive mental health services during the school day, our school psychologists, social workers, Rob, you can speak to this more than I can, but they're not doing intensive therapy in any of this
Right.
sort of thing. We're talking about initial interventions and referrals to outside services that the parent can then select the one they're most comfortable with. But we're not talking, correct me if I'm wrong, but I think we're talking about assessing the situation as it impacts the student and the school environment, and then referring them to an outside resource of the selection of the family to provide more intensive therapy or whatever if that's needed. But we're not talking about therapy, we're
That's
talking
not how
about,
I understood this.
that's how I read it,
I'm
so.
looking at this as if a kid is caught smoking, they're gonna be sent to the student assistance counselor, who's gonna talk to them about, hey, what's going on, why you smoking? Parents will be notified that this conversation went on, and then the student will be told, okay, I want you to maybe watch this in-depth video, and then after you've watched it, why don't you come back and let's talk about it and see what you got out of that program. Or they may say that, they have to write a 2-page essay after they watch a video about tobacco products. And I know that the most successful program with the students is when we start, in my past life, I was a tobacco cessation counselor. I was certified in the state of New Jersey. One of the things with this age group is that we show them presentations about how the companies are manipulating them and the stuff that's really in there that you're smoking. Like, did you know that you're smoking arsenic when you light a cigarette?
Formaldehyde.
And they actually get very angry because they've been manipulated. And it also goes into the health issues on things and, the long-term effects, although they don't see those long-term effects when you're, 14 years old and you're starting to smoke cigarettes. By the time you're 28, you're going to have long-term effects already significantly showing. So it's kind of a strategy to, all right, let me talk to you. I think you're gonna do real good with that in-depth program. Let's have you do that one. Or let's have you watch this video and then write me an essay on it. And certainly if there's a heavy addiction, like this is the 4th or 5th time this kid has been referred, at that time, they may very well say to the parent, look, your kid definitely has an addiction to tobacco here, and we really need you to now step in and maybe get an outside counselor involved and see what can happen. Parent can always say no. I'm okay with it. I don't care if my kid smokes. And that certainly is their prerogative and their option. But I think we as a school system also have to make them aware that this is not acceptable behavior and the long-term effects on your child are going to be. So I don't see this as the old, here, lay down on my couch, let's delve into your childhood and all of that. But more of a, uh-oh, what happened? You were caught smoking, what's going on? And open up some dialogue with them. Have them maybe view that in depth, and then the counselor can say to them, you know, why don't, after you're done with that, call my office, let's schedule an appointment, 10-15 minutes, let's see what you learned from that. But I'm not seeing it as therapy.
But what's the negative of adding to the policy that parents can view all the curriculum or programs prior to their student, their child viewing it? Like that
Oh, they
could
can.
be,
I would assume
You know-
that we are allowing that.
I know, but it's not in the policy, so maybe that could be something added. Because
Okay.
it's not clear that parents have permission to view what is going to be shown to their child. And then my other question is, if there is no SAC at the middle schools, what if a middle school student is caught smoking? Who are they referred to?
So maybe I was just gonna suggest we find out what the practices have been.
Mhm.
I'm just looking on the RISAS website, and it does have for North Kingstown, there are 3 staff working here, one at the high school, one at Davisville, and one at Woodford Middle School.
Okay.
So the names are here, but I would imagine, and many of the other districts that they're working in,
Mhm.
as you said, there are many have adopted this policy, several years ago, so they might have experience. So I would just say, find out what has the practice been, what are they doing now? Just because maybe the policy wasn't as such, they might even be doing some of these things, but to find that out, right? What have they been doing, and are they familiar with this policy? And do they have colleagues who are in districts working under this policy? And maybe, again, this is a model policy, so I think those kinds of changes can be made, but the whole idea of shifting it from a punitive, and moving it more towards a,
Educational.
supportive and,
I also think, I feel like we're treating the symptoms here of a bigger issue. Nothing's being addressed, we're not addressing the root of the problem. Like, I feel like as a school, the superintendent, administration, perhaps could meet with legislators, the governor. They legalized a lot of this stuff, and this is the trickle-down effect we're seeing in our young adults, we're seeing in our high school kids. It's exploded, and they're responsible for a great deal. And I think they need to hear from the administrations, but not just our school system, but from around the state, this is what's happening to our kids. So, it's good to do this, but I think we also need to get at the other end of it
yeah,
too.
they have passed around flavored, nicotine, so they have done a lot. Are you talking about nicotine products?
Yeah, but I'm just saying, they legalized marijuana.
Well, that's a
and,
separate-
I mean,
that's a
and
separate
that's what's in a
thing.
lot of the vapes and that,
Yeah.
That's
Right.
what.
Yeah,
So I
right.
just, and I don't want it to sound like it's anybody's fault, but just as someone who specializes working with adolescents and substance use. In the state, not just in North Kingstown, all 80% of the kids probably vape in the bathroom at school. Why? When I went to North Kingstown High School, we were allowed to smoke on campus. That's how old I am. But in this day and age, I don't get it. I don't get why kids are smoking in the bathroom.
Cause I think they're addicted, and they
Of
can't
course
get
they're
through the day.
addicted, of course they're
Yeah.
addicted. But how come we can't stop that? I don't
I
understand.
think part of that is probably the way it's always been. I'm probably the oldest person in the room here, but I remember going into the girls' room and you would open the door and the smoke would billow out. So
Right.
whether you were a smoker or not, you were smoking.
Yes.
And it was the cool place to hang out. And yes, I was a smoker, so in between classes, I'd quick go in and I'd
Yeah.
snub my cigarette so that I could finish it between classes and the next class. But part of that was also a confidence builder for me because I went to a very mixed racial, and it was an inner city school where everybody was filtered in from the different community elementary schools, and I figured if I smoked, I would look tough, so nobody would mess with me. I didn't even inhale. I kind of went and blew it out my cheeks, and it worked because nobody messed with me. And I think it's also, we see a lot of it still in the industry, that people they admire are smoking. So I think we have a lot to do there too, but I think it's still isolated to the bathroom because there's no bathroom monitor. You can go into the.
Can't something be done around that? I don't understand that. Everybody knows our kids are going in the bathroom and vaping and getting hooked on it.
Right.
So part of the problem with that is that they do oftentimes they do it in the bathroom stalls. Can't go in there.
Right.
Right.
And with the
Okay.
vapes, you can't even
Can't
smell
touch
it.
no.
Vapes are
Yeah.
vapor,
Yeah.
so they dissipate pretty quickly in the air. It's not like cigarette smoke that hangs in the air for a long time.
Right.
So it's kind of built that way to be undetectable. It's kind of why vapes are popular and why they were popular, especially among kids. We have, at the high school at least, I know they assign people outside the bathrooms to monitor. But it's hard. It's hard to catch kids. It's a lot harder than people realize, because there's privacy matters that have to go into student bathrooms that are important and that can't be
Yeah.
obviously, violated. So, students have the ability to do that from time to time, and they make bad choices.
And the last survey that I read that came out nationwide from the CDC is that most young adults are not smoking tobacco products like cigarettes and pipes. They're vaping because they perceive vaping as to be a healthy alternative. And the industry perpetuates that, such as there used to be a program, if you wanted to quit smoking, transfer to vapes. Then you could quit smoking.
And I think
Because
some
it-
adults, parents too, are vaping. I don't know here, but I know in other schools, the
Absolutely,
parents will come in and say,
Yeah.
don't give that back to me, I paid a lot of money for that, my kid can have it, it's not as bad as smoking. And we vape in our house, that there's education too, could be for adults as well, that I agree, that tobacco, and we pretty much had it when you looked at the data on smoking cigarettes, it had really decreased. And then the industry, as they do,
Right.
with all the money they have, came out and created this product that has now gotten so many more young people and adults hooked again.
Well, when vaping started in New Jersey, being in a college health position, I actually went to a couple of vape stores and pretended I wanted to buy a vape. And they're very good at their sales techniques. They even have where you can sample the vapes to get the different flavors. And they have flavors from bubble gum, and who's gonna use that? An 8th, 9th grader, right? They have Tutti Frutti, they had them named after different movie stars and bands and things that I never even would think that they would do. And the guy said to me, look, if you don't have the cash to pay for this, I mean, obviously we take credit card and stuff, but we can put you on a payment plan so you can pay me like $2 a week until you pay off your vape. That's the kid who gets his allowance, who's taking his allowance now to the store to pay off for the vape. So the other part of this, along with the education, is we have to remind them, you're being taken for a ride here. I mean, they're exploiting you, and exploiting you big time. And kids today, from what I'm gathering, is they don't like to be taken advantage of. They don't like to be told what to do. And in essence, the tobacco industry is telling them what to do. And I'm not even talking about the vape that has THC in it. I'm just talking the straight tobacco vapes. And I actually bought a vape from him with a blueberry flavored so that I could show my staff, this is what they're doing and this is what it tastes like. And 3 of my nurses said, well, that's pretty good tasting. And I was like, no.
Those
That was
can't
on
be
my point.
flavored tobacco, can't be now sold under 20, everyone. So, but they can
But
get
it
them
is.
online, they
Yeah.
can get other people to buy them, and quite
But it
frankly,
is being
they
sold
sell
under
them
21.
under the counter and
Right.
not, but they
Right.
legally can't be sold. So the legislature has tried to do things, separate from, I understand, the marijuana issue.
I think we need to educate much younger, just like we did with
Yeah.
smoking,
Well,
start in
what-
elementary school
I think
and
we've
really
talked here about
enforce-
the health curriculum, the new, and that clearly is part of the health curriculum.
Right, I was
Every
gonna
health
say, isn't that
educator
part
now
of the
knows
health curriculum?
Yes.
vaping
Yes.
is a huge part, so that goes hand in hand what's happening in health education. I don't remember at what age, it depends whether some schools do upper elementary start talking about it, but certainly at middle school.
Do we have statistics for our district about what, how many students get a first offense, second offense, third offense? Like, do we have statistics for the high school and the middle schools?
I don't have those, no.
Do those exist?
So we have some data that, I know the Prevention Coalition did a survey, that was, it's been done the last couple of years around, percentage of students who vape and who use alcohol.
But do we know what percentage of students have been referred to whoever they're referred to?
Offhand, no.
If they're caught smoking?
Yeah, offhand, no. Could we look into that? Yes.
Because
you must
if
have
we're
to
gonna,
track it, right?
Yep.
yeah, and if we're gonna implement a policy, we should see what the data is
Sure.
before and after.
Yep.
Sure.
And
Cause then you
wouldn't
can
it be
kinda see
good-
if the policy
You can
is
see if
working or
it's
not,
working.
and then maybe, and I do think, is the education they're talking about here, is that an extension of the current education we're already doing?
There's very limited current education that's going on, from what I understand.
Okay, cause I feel like the new health
Current education.
curriculum has, we
There
talked about
was a
the-
section in it, but I don't remember what grade it started, was it middle school?
There's
I don't think
education
so.
in
It was in
the
the
health
6 or 12,
programs.
right? I mean,
I think it
Yeah.
was middle school,
I
only
don't
'cause
think it was
my
in the
girls
2
talked
through
about it in
5,
sixth
I'm
grade.
not, so
I
6
believe
and
may have
12.
said,
I
like-
believe it's in the health program, like in the health classes where they get
Oh,
the
yeah.
education.
It was definitely in 6 through 12, cause
Yeah.
right, that's
Yeah.
why that curriculum. one of
Right.
the
And
reasons.
precisely what you're saying is now a part of it. Again, recognizing, telling young kids about what it's doing to your lungs, it doesn't have much of an impact as much as talking about the marketing that's done to them, specifically targeting them, to get them hooked. So that definitely is
Cause
part
I
of
feel
it.
like who was that group that came in and spoke to us, they were talking about
From
that.
South Coalition.
Yeah,
that
and how
was
they were
really
saying,
good.
yeah,
they were
didn't they have a program where they were teaching the
did.
kids
And they
about,
brought in like examples.
yeah,
They
about
did.
the negative advertising
And
and,
that, some of that curriculum is targeting elementary schools. The Prevention Coalition's
Yeah.
curriculum.
Mhm.
Rob, if you look for the, data on the referrals for, the student assistance counselors, can you, add, I'd be interested to know how many, like, the number of referrals, but also the number of self-referrals? In other words, at the high school level, I think more than at the, middle school, but at the high school level, I think there are students who self-refer, and I'd be curious about that as a layer of the effectiveness of the folks in those positions, because sometimes, that's an added dynamic.
well, and it could also see if the health curriculum is working, like if they learned about vaping in health class, and then we're like, oh, I shouldn't be doing this, and then they're having trouble stopping, because obviously it's an addiction.
Do the kids know who the student assistant officer is?
Is that like part of the orientation the beginning of the year?
I mean, I think they do, but they may not. Some of them may not.
I'll
I
ask
think
mine
that the,
tonight.
I think,
They had tables at open house, for example, and at the middle schools, both DMS and Wickford Middle had tables from student assistance counselors set up. And I know that the student assistance counselor in the guidance office at the high school, I know that the high schooler, at least anecdotally, that they're aware that.
yeah, I mean, in my experience, and again, I don't wanna speak like this is always true, but in my experience, most of the student assistance counselors' interactions with students came from, referrals through offenses that took place. But what happened is, through that process, a lot of times word of mouth would kind of spread. And so kids would talk to their friends, and they would talk about, Miss So-and-so, who they really like, who they talk to about such and such. And so they would be like, almost like more that would come from that, like word of mouth type of things. I'm confident students have been told about it. Whether they remember it, I think, is another thing, because like I know, especially with new students, a lot of information is thrown at them in a short amount of time. So they may not remember, but I do think over time I've seen that happen where students who connect with the student assistance counselor, a lot of times, to be honest, it isn't even sometimes about substance use. It's something where they just have a relationship with that person and they want to just, chat with them. And that's kind of the environment that the SAC likes to create. Is sort of a welcoming environment where kids can come in and feel free to chat with them if they wish. And words usually spreads through, like I said, kids, kids talking to each other.
So if a student self-refers themselves, does the parent get notified when they've self-referred themselves?
I would absolutely think so. If there's a self-referral, like a
student decides they went to health class and they don't wanna vape anymore and they go to this to ask for help, does the parent get notified that the student sought that person out for that?
Yeah.
I don't think so.
I would think not.
Yeah.
I would think not.
And I would assume it's a case-by-case basis,
Yeah.
depending on the nature of if the student's like, well, I have a friend, or I know somebody, and it's like, and it's who's been thinking about, if there's a concern for the child's welfare and
Yeah.
safety, it's different, there's a different situation than if there's not, right? So it must be on a case-by-case basis, I would assume.
I would agree with that. Yeah, I think it's
Well,
based
middle
on.
schooler is different than a high schooler, so I would hope a middle schooler's parent would be informed.
I mean, maybe, I know we've had, Zoomed meetings here, would it be to ask, I know that the Rhode Island Student Assistance Services are out at different meetings, just to ask them, since people aren't that familiar with the role of the student assistance counselor, because I would think that person, not that they're gonna write the policy, that's your purview, but just give some input as to, again, what the practices have been now, like, and whether, are they even following something like this, but maybe to invite one of the counselors, and if it's too challenging, cause it is in the evening after work hours to attend, I don't know if they could
Or
easily
you could look at
do
the
a Zoom.
policy and give some feedback, what they think, if this would be helpful, or they would like to amend it some way.
See, one of my concerns with what you're saying is if a kid self-refers, when I was a counselor, and we had 17-year-olds who entered college, and they would come down and they're like, I've been vaping and I really wanna quit now that I'm in college. And it'd be like, all right, I would be very hesitant to right away reach out and call a parent for fear that they wouldn't come back. There's kind of an implied trust when they come to see me that this is between us. Now, certainly if the kid tells me I have asthma, I'm not able to sleep at night without
coughing up
sleeping on,
blood.
sleeping on 3 pillows.
Yeah, no, I understand,
and-
but if there's an 11 or 12-year-old, which is a middle school,
Right.
which has access to this person, then that is different than a 17-year-old. And if I was the 11-year-old's parent, I would wanna call. That's what I'm saying.
Right.
Like, I just would like to know how that is fleshed out. And I think, other parents know. I mean, I didn't even really know what a SAC was, to be honest. I don't
Right.
go to every table, I don't have time. And, so maybe there's more education that needs to be offered to parents about what this role is and how they interact with students.
Well,
And again, middle school is different than high school,
Right.
and there's one at each middle school.
No, I agree, because I think the open house, the tables are there, it's just my opinion now, being new in middle school, it would be good if they actually had a session where they speak to the parents, like,
Yeah.
and just gave like a little, even a 10-minute presentation.
At the
Because I don't know that
opening
everyone
night.
knows, because I feel like it's overwhelming, to be honest, when you get there, you're not even like, what are all these tables, what should I do? Where if you were like, oh, go to, the gym, and then they're gonna get up and speak for a half hour about, random.
That you would know in advance, this is what they're gonna say to them.
Yeah,
or
I
whatever.
expected that to happen, I'm not gonna lie, I thought cause usually in the elementary school, the principal gets up and gives a whole spiel, and then if anyone wants to talk, they do. They don't, I don't know about Whitford, they don't do that at Davisville.
The principal did speak at Wickford, we did get a
All
whole
right, so they- at
introductory, but
Davisville
that
they
would have been a good time
But
for
it's
that
also, they should be doing the
person.
same thing, right, like at the two schools, so yes, but it'd be a good time to be like, hey, here's the SAC, here's you, talk
Yeah,
about
and
family
just like
learning.
a little
You know,
blurb about what they do, so
Yeah.
if families do
I think that's a good
wanna know.
opportunity just because we kind of have all the parents there.
I'll work with Rob and see
Yeah.
if we can get one up to the next meeting, one of the, substance abuse counselors here, that they can tell us, first of all, what their job is, what they do, and what protocols they're following.
Yeah.
And this way we can move forward from there, cause maybe they're doing all of this already, but it's just not in
Exactly.
writing.
Right, and that'd be
So,
nice
and it
to
might
know.
be able to streamline it with them, saying, oh yeah, we use that program already, I have it on my computer and the kids watch it, or whatever they're doing.
Yeah,
And
then
also
there might be
find
some
out about the
regulations of
parental
age
notification.
There could
too,
be
like,
some
okay, up
regulations
to
about
16,
age.
you have to do it, you know, 'cause
Yes,
I'm sure there are.
Right.
yeah, like, just even like the state having some that we might not know about.
My gut feeling is that they probably are notifying the parent, simply because for the kid to have a vape is illegal. And that now becomes a whole
Right.
bigger issue than just my kid smokes vapes, my kid's breaking the law
right,
and smoking a vape.
correct,
So they may very well take that standpoint to say,
right,
or on the side and, you know, that. But again, they're gonna get the parent who says,
Right.
I don't care if my kid vapes, you know. We used to see it in college where the kids would get so drunk the first week of school and have to be transported to the hospital. And the parents were like, hey, rite of passage, that happened to me too when I was in school, and it's like, but it's hard to change behaviors when parents are enforcing it, or endorsing it, I should say. So, okay, so Rob, we can work on
Yep.
that for the next meeting? All right, so at this point, I guess what we should do is just review the policy carefully, listen at the next meeting to what they are doing already, and see how we can incorporate that into our policy, and then go forward from there. Unless anybody has anything else they wanna add.
Could we possibly find out what the prevention retreats that are curated,
Yeah, I don't know what that is.
what that might be, just out of curiosity?
And we don't have to,
Yeah,
right,
that
like, this is the state
I
policy.
would never support that
No.
at
So
all,
we
in
can
any
just-
way, shape or
Yeah.
form,
Right.
ever.
So we could just
Like,
change
ever.
it to be like,
What do you mean?
I would never support a retreat that would function in that way. Like, that, to me, that's just like a little
Yeah.
over the
We don't
top,
have to copy every
you know?
single
Yes,
one
right.
from
Really
Yeah.
over the top.
Yeah,
so maybe almost like cross things out that we don't
and
Yeah.
add.
like it
Yeah.
and add for the next
Yes.
meeting
Yeah.
too, like
Yeah.
things that we would, but, yeah, I was saying that the state suggested this, but.
I
So,
know,
and
I'm
just-
gonna reach out,
just
I
another
work with them,
aside, like,
I
I
don't
would-
even remember ever
Other-
seeing that in there.
The what? I'm just curious to know what exactly they were envisioning when they were I lost my train of
maybe
thought.
it's a poor choice of words.
Yeah, I don't know.
Yeah.
You know,
To me,
maybe,
it's
maybe
not.
that, you know, retreat,
No.
it has a connotation, and maybe that's not what they really meant.
So East Greenwich is thinking about implementing like an outside program, and talking about maybe doing it like, I'm sure there's like at the high school some type of like peers that are substance free or whatever. And I just don't see that kind of model really working, because the kids that have substance use issues are like the opposite of kids. I mean, maybe at some point, but I just feel like support is a big thing. And for substance use, which nicotine is a substance use problem, having support is really key to kids this age. So I like the idea of the in-depth being like a group type thing, and especially if it was like in lieu of detention or something.
One of the things that we started at the college where I was peer education. And for the smoking cessation, we did a support group for smoking cessation, and they named it Ramapo Kicks Butt. And that enticed a lot of people to come. And then once they were there, they would buddy up, almost like the fraternities and sororities. You'd have your big brother and your big sister that you could call and say, hey, I want a cigarette, like right now, you
Right.
know, what do I do? It was almost along the lines of like AA.
Right.
And they they had a really good response with that because it was their own peers. It wasn't Debbie, the medical director, saying, oh, that's not good for you. It was their own peers saying, you stink. Your breath stinks. I wouldn't want to kiss you, man. Who's going to date you? And that, believe it or not, that very reason was very instrumental in a lot of people quitting because they didn't realize that the odor stayed with them. Like, you know, one kid said, it's like kissing an ashtray when you kiss a smoker. And they were like, what? You know, and they didn't get that. And having their peers point out that, you know, you're prepping, you're doing your hair, you look beautiful, but you stink. And, well, but that really became a big issue.
I know, so
They don't get
but
it.
it's
Now
kind of
they smell
like,
fruity.
I like that though, cause it's kinda like, you know, when a bunch of friends are like, I'm gonna go on a diet together, or I'm
Right.
gonna exercise together, it's sort of the same, like, we're gonna try not to
Right.
vape anymore
And
to
a
get
lot
together,
of
you know what I
these
mean?
kids wanna stop,
Right.
like, they know.
So it's nice to have, like-
It's such an addiction and they know it. And
The in-depth, like, so that's like a group thing, but what
So it
if,
sounded like
if there's
to me.
only like one kid coming in, like, I don't get how that works, so is it, where's the group go, you know, like,
Yeah.
I don't think
is
would
it just
be
a group
one
within the
kid
school,
coming
is it a
in.
group?
Yeah, but
I
it's
didn't
Well, I
quite-
think
I
the
just
data,
looking at
this is
the-
where like the data would be helpful, just to see
Right.
like how
Yeah.
many how many
And they
people
can-
are getting
RISAS
caught.
can, I'm
You know?
sure, inform you in districts in high schools that have been using this and have used this policy and how it works.
But
So I think just, it's important to hear from them, what's been done, what's happening now, and what, schools that are using, this kind of a policy, how they're
But I think you mean data like from the student
Yes.
assistance counselor.
Yes.
Or
How-
from the dean, isn't it the
Right.
dean that gets involved, like at the high school
Like how many
level?
people are getting caught in a
Infractions. Right.
in a
And what
semester,
are
a
you doing?
year,
Just
what,
giving them
you know, what is it?
detention?
I don't even know what that
Yeah,
number
which
looks like, I
I don't
couldn't
think
even
pulling them
fathom
out
a
of their
guess.
activity is helpful,
No.
their
No.
sports, or your club, that's
Yeah.
probably the worst thing you could do.
Cause when they're there, they're probably
Yeah.
not
I
vaping
know.
all the time in the world.
It might start as a behavior, but really it's an addiction, especially like with the vaping. I mean, it's
But if
so
there's
fast.
not a lot of kids getting caught, then like really a lot more focus has to be on prevention than, you know,
Sure.
because we're not catching them, so we're not doing any of this. I don't know what that number looks like again, you know, so if we know the number because of the survey, which is everyone who admits it, is this percentage, but the actual kids that are being caught at the school are
Right.
this, then yes, this is great, but really prevention is what we need to,
Oh, God,
you know what I
yeah.
mean?
Mhm.
Because then,
Oh.
then this is not gonna have the effect we want, because this is once the kid is caught.
Sure, yeah, you're, it's almost like going back to cigarettes, right, I think
Right,
that's how it
you know?
stopped, was like prevention versus
Prevention.
kids
But
getting
it is
detention.
helping them to quit, so
No, I get
back
it.
in the old days, you just would go home and
Yeah,
you'd
yeah.
sit home and vape.
I don't,
And then come
I'm
back
not
to
saying we
school.
shouldn't have it,
Yeah,
I'm just
yeah.
saying
And
there's a
that's what
whole
kids are
nother,
still
Yeah.
like how many kids
Yeah.
is this gonna impact
Yeah.
versus what that survey who could be people who aren't getting caught or whatever, and then, you know, you
See,
kinda need
the-
both.
The hard part with the vaping is that it takes away all that cigarette smell.
Yeah.
They don't have you know,
Much
so
harder to get
it's-
caught.
Right, cause I remember coming home and my mother was like, were you smoking? And I was like, no, Jane was, it just all on my clothes. And I had been smoking for years at that point.
So-
But nowadays with the vaping, again, it's so hard to detect. So even though we're not catching them, doesn't mean they're not doing it.
Agreed.
So can I
You
ask,
know.
as the wellness subcommittee, could we also work on like a prevention program at the middle school? Like that's
Right,
really where it
that's
started, not the high school, it's like before the kids even.
I was gonna say even at the elementary
Yeah.
level,
Like
cause,
fifth grade, yeah.
I think early education and intervention
Mhm.
is key to preventing what we're just talking about.
Right.
Right, and so whatever's appropriate for younger children to understand, more so vaping, their parents may be vaping in front of them.
Right.
Even though they're not vaping, they're exposed to it, and they learn from their parents. So I think early intervention and education is important in what's appropriate at the elementary level.
At
'Cause I think kids
elementary, I would think like talking about, like what foods are good for you, what foods are bad for you, like energy drinks, sugar, like.
I just
really,
fear the
yeah.
point that they're seeing their parents do it.
That's why they need something at school or somewhere that.
Yeah, well, that's
to
why I was just
educate
asking,
them.
like, instead of
Right.
just making a policy, I feel like we need to be doing something.
So if we, I'm kinda jotting down some notes about what we wanna prepare for next meeting. So what I've heard, and correct me if I'm wrong, or add if I'm, so we wanna look into some data on vape offenses, like first, second, third, right, just some data on
Both
that.
middle schools and the high
Yep.
schools.
Yeah,
And
Yep.
self-referrals.
We wanna look at, student assistance counselor data in terms of like referrals. I don't know if it's separated from like self-referrals versus
Yeah.
referrals. I know, like, I can remember in my principal days, the student assistance counselor would provide us with just a kind of a generic list of referrals.
well, anything's better than nothing.
Sure, absolutely. So we can look at that. That would have to obviously be numbers only, you know what I mean?
Yeah, yeah.
We can look into inviting a student assistance counselor or representative to the next meeting, so we can look into that, okay? We kinda talked a little bit about like behavioral offenses, like getting a good grip on like what type of response or consequences students face or steps students face when they are consequenced for a vaping offense. Is that something we wanna look at?
Yeah,
Like
'cause
what,
Or what
we were
districts
kinda saying
are
like,
on
what
this.
is what does happen right
Yeah.
now?
at the middle level, at the high school level?
Yeah,
Okay, so we can look into that, just to like I have a pretty good idea about it, but just to make sure like we're really understanding
well,
of
even
that.
to ask is it working? 'Cause
Yeah.
maybe they're doing things that are working that just aren't technically,
In the policy.
in the policy.
Yeah,
Right. Because like right now, I'm working with someone from Tollgate who got caught vaping at school, was suspended, and then just went back to school.
Mhm.
Nothing's changed.
And also
Now
getting-
she's just not bringing a vape with her,
mhm,
she's just going in the bathroom when her friends are in there.
yeah,
So it's like, that kind of stuff is like heartbreaking to
Well, then
me.
getting suspended, you're missing a day of school, which
then
actually
you're
isn't
getting
good, cause then
behind
you're now,
and-
right,
Yeah.
it's like the
And
never
you're-
ending.
And you're being punished because you're addicted, like, there's no like, nothing to help her, she's just right back in there.
Can we share the policy with them and see what they think of it? That we're
our
considering?
policy,
Yeah,
The
or
Rhode
the,
Island
state
one.
the
one.
mo- the,
model.
the
Yeah.
state, the
Very
model one,
much
yeah, I
Maybe
don't see why not.
what they like or don't like or
Because
Yep.
they're,
Well, cause right, they're
Or
gonna be the ones that
state
implement
using it.
And
Yeah.
they may already be doing it.
right.
Yeah.
So
Right,
this
you
way,
don't-
we're like,
right.
spinning our wheels when they're like,
They're
oh,
already
we do
doing it,
that.
yeah.
That's already part of what we do.
And I also wanna double check and go back to the health curriculum, specifically the pieces about vaping prevention,
Yeah.
okay, like the grade levels
Yeah.
and sort of, we can come back with that. Okay.
There's a whole curriculum called Media Ready that the Prevention Coalition does for elementary that helps them kind of see, like somebody was saying about the ways in which people are manipulated by the
Yeah.
tobacco industry and so forth. And so that's like an existing curriculum that I know we have like at least one, we have at least the North Kingstown Prevention Coalition person is trained on. It's just a question of one thing that I think would be helpful to think about is whether or not that's something that we'd be encouraging to happen at schools, folded into the school day, and how would that happen, given the constraints on the school day, or like we're working on implementing that curriculum as part of an out-of-school time program right now at Quidnesset, so like is that something that we as a committee could somehow support for other elementary schools to offer in different types of arrangements?
Yeah, or even I wonder, all the schools have an assembly, like, could we do an assembly just around that?
Or even if the teacher is teaching the health curriculum and it's getting to the point where now we're gonna be talking about tobacco, maybe have somebody from the Prevention Coalition come in and guest speak and bring all their little, for lack of a better word, toys and diagrams and stuff that are age appropriate to those children, so that they can see, and have them take over the lecture for that part, as long as they're covering the criteria.
Mhm.
So I'm sure like the principals and the health educators can probably give input as
Yeah.
to how
Right.
much of an issue, what are we seeing, that kind of baseline data.
And certainly so I work in the Office of Family Learning, and certainly something that we can look at is ways of offering, resources, geared towards families, because as Jackie was saying, it's, you know, a family issue in many cases, so thinking about ways in which if as we look to support families, how can we start not just with the younger kids, but also thinking about how we can
Get the parents.
channel resources to the whole family.
Yeah.
You know, obviously, we're not gonna mandate it, but
No, but
certainly
optional
making
opportunities,
sure that
yeah.
those resources that exist are ones that they can know about. So that's something that we can look towards.
And they may not even know that there's resources available.
Yeah.
Yeah.
That's the other part. You know, they too probably know this isn't the healthiest thing I'm doing, but I can't quit, so what am I gonna
And
do?
it's also economically very, I mean,
Very expensive.
it's an expensive thing
Mhm.
to
Mhm.
have to be paying for it,
Mhm.
and if you are addicted, it's not really a choice thing, so.
And I've had parents say to me point blank, the pot's not going anywhere, they're just gonna have to deal with it. And the kid's actually trying to stop,
Yeah.
and they're in an environment where, and there's no, like, they're not open to family education, they're not, so it's like getting that kid, and, I mean, I really believe in I liked the three, the assessment, the screening, but like separate individual meeting with the kid, because that's where you're gonna get the honest answer, I think.
Well, the other issue too that always comes to mind, when I started smoking, a pack of cigarettes was 75 cents. And then New Jersey taxed it higher and it went to $1.25, so I had to figure out how to make the cigarettes last until I had the next $1.25 to buy it. A pack of cigarettes is going for almost $10, if not more right now, which becomes an issue of where are they getting the money for this? You know, if you're giving your kid a $20 a week allowance, that's a lot of money. I mean, I got 50 cents and I thought I was rich. But, you know, they may not realize the financial impact on them too. So there's a whole lot that has to be encompassed in this, and again, maybe they're already talking about all this. Maybe when they're notifying the parents, they might even be doing a small assessment of the family to say, are you smoking at home? Because your child is now mimicking that behavior. And maybe, you know, provide that outreach in that manner, and they may already be doing it. So, well, this was all great input, and I'm trying not to extend the meeting too long because we all kinda had to rearrange plans because of the scheduling issue. But, and we have no citizens here for any comments. So, anybody have any new business they would like to discuss? Just everybody remember to vote. That's the big thing I have to say. Can we have a motion to adjourn then?
So moved.
Okay. Second?
Second.
Okay. And if anybody didn't sign in on the sign-in sheet, please do so that you get credit for being here.